Around 80% of the rural United States is considered medically underserved. Hospital closures, specialist shortages, outdated technology, amongst a myriad of other deficiencies, has led rural Americans to have worse outcomes and less access to care. Dr. Oz discussing the implementation of telerobotic ultrasound systems in many of Alabama's rural counties, 50% of which do not have a single OBGYN, has opened many discussions about the role of remote robot assistance in healthcare. How do these machines work, and what impact can they have on rural medicine? Welcome to BS, a podcast where we take an in depth look at different scientific and social phenomena and innovations, whilst tying them back to broader societal perspectives and why you should care. We hope you enjoy the episode.
This is going to be when our subscribers, like, this is going to be their first intro into the fact that Ilyana is taking over the world with robots. Like, I honestly think, like, I can't hold it back anymore, guys. Like, if you know me, you know that the first thing that got me into STEM was robotics and artificial intelligence. Listen, so topics like this always get me super hyped and super interested. Hey, what can I say? My plan is being revealed.
No, I definitely remember even all the way down to high school, like this being your thing. But guys, remember this episode when them Tesla robots start tearing things up? Like, remember who stood beside them when the Waymo runs you over?
A
Like,
little bye. But on a more serious note, like the technology is always super interesting to me, but the way that human beings apply it, man, like that's when we start to get into the more complicated parts of the equation. And also, when we were researching for this episode, something that doesn't sound real to me, Gold, is that apparently 97% of the US, like of US land is rural. And like even though that makes sense when you like pause to think about it from like a geographic perspective, I'm still just like, wait, no, like that does, but then I have to remember that like urban centers or cities are like densely populated small areas of land. So like, yeah, probably the majority of the land is going to be rural, but it's still crazy to think that that's 97% of the land in the US. Like,
no, on the same note, I was looking up what constitutes a population that would be considered sparse enough to be considered rural. And I'm looking up cities that I've been to that I think might fit the bill. And when I tell you I am so far off in terms of population density, it was definitely giving city girl, city slicker. Like, you do not know what a bad day is. You don't know what's going on besides your walls.
no, literally, like they genuinely, like when people are talking about rural and they're describing like, yeah, there was one singular grocery store and it was a 30-minute drive, and I'm like, oh, like I actually have no idea what you're talking about. That I've never lived in a rural area actually. But no, that's very, very interesting to me. With that, hello everyone. I'm Ilyana.
And I'm Gold.
And welcome to the lecture hall. Today we're going to be talking about robots, working them remotely, healthcare, how do all of these three things intersect? Like, very cool, very interesting, very dystopian in the times that we're living in. Because listen, if you haven't been hearing about everything going on with robotics and generative AI, I genuinely don't know what rock you've been living under. But with that, let's get into our guided research questions for today.
Yeah, so today we're going to be talking about one, what are some different applications of remote robot assisted healthcare? Two, what are telerobotic ultrasound systems? And three, can remote robot assisted healthcare help decrease the disparities in rural healthcare?
And listen, what as I always say at the beginning of the episodes, we really aim for you guys to tell us, listen, hey, we're just the messengers. Okay, don't shoot us, we're just the messengers. We're coming to deliver the information. We want y'all to critically think about these things and talk about it in the comment sections, email us. Like, we really want to hear what your feedback and inputs on these very cool technological innovations coming down the pipeline are. So, first question, what are the different applications that we can use remote robot assisted healthcare for? I think that the main main kind of thing that people associate robotics and healthcare with is surgical robotics specifically. And the most common kind of idea is like, I don't know if y'all have heard of the Da Vinci system. It's a very huge, like, I think it would probably be the most popular surgical robotic system in the world. It's made by Intuitive Surgical, which is actually like a really cool company. This is my pitch to work for them one day, lol. But what do you call it? The way that these systems works is you have these robotic arms that can have a variety of different end effectors on them. Also, you have vision system cameras, and the end effectors are incredibly tiny because they want to be able to perform more precise, controlled surgeries. So really what's happening is the operator or the surgeon is making these moves, and through haptic feedback and sensory location, it's being translated into smaller movements. And this is good because smaller incisions lead to less blood loss, less post-operative pain, shorter hospital stays, faster recoveries, and just less complications overall than traditional open organ surgeries. And then obviously, because of the fact that you're kind of having to relay a lot of information over a connection, the connection has to be very high speed because of the quick reaction times. Because obviously, if somebody's cut open on the table, you can't have lagging, or even like a 5 millisecond delay could be incredibly severe.
Yeah, I think about like electronic, like just like electric outages and like ooh, the generator not working during like a surgery like this. But hey,
You know that I
but
almost got shocked twice today at work, Gold. Like, I almost got electrocuted twice. And this is what happens when you have a biomedical engineer doing electrical engineering. But anyways, like,
twice is killing me. Like at that point, if I was your manager, I'd be tapping you on your shoulder, like you got one more chance with my little yellow hat, hard hat on. Like, okay, girl, one more chance. But yeah, the way that they do surgical remote robot assisted surgeries is very similar to laparoscopic surgery. And honestly, like that's such a popular surgery this day. If you know anybody who's had surgery on any part of their abdomen or trunk, there's a very good chance that it was laparoscopic surgery. And this kind of works where they take a little tube that has a camera and insert, well, they like use CO2 to kind of like expand your stomach or abdomen so they can look inside, and they take a tube that has a camera to insert that in. And instead of making large incisions in which you have to like leave people with a lot more scars and have more risk of bleeding, there's usually multiple small incisions. Oftentimes like you'll have like one near your belly button, and obviously it depends on like if they're just there to look for something, if they're there doing a surgery, and what kind of procedure that they're doing. And they have specialized tools obviously for this, and basically the surgeon would use these specialized tools to go through the tinier incisions while looking at what's going on through the camera that they inserted. So it's kind of very similar to that, but take that and insert it into like a robot. And instead of the surgeon being there moving the arms and it being like two, it's more like four arms and like the surgeon kind of watching through like a very high definition screen of what's going on. And there's been great reports from surgeons. Like I've seen them say like, oh, it feels like I'm in the examination room and things like that. So that's like a very common version. And there's also different types of remote robots too beyond the surgical ones. Like there's rehabilitation slash exoskeleton robots. So if you've ever seen people who are paralyzed or who have recently had some kind of like spinal cord injury, and you I feel like there's always like viral videos of this, like like getting to walk at my wedding, or getting to like finally like hug my like mom standing up, where you kind of like see the robot kind of get attached to the back of these people's bodies, and it kind of helps them move their limbs. And it's also good for physical therapy sometimes as well, because it's like keeping those muscles active and keeping those nerves moving, and so it can help like with atrophy, and also for the people who aren't like having a full spinal cord injury, it could also sometimes help them to regain some of that movement. Another version of like remote robotic assisted healthcare is telepresence slash remote care robots. These allow like physicians to conduct remote consultations, and like we kind of already have remote consultations with some non-procedural physicians such as like psychiatrists, and for some dermatologists as well. And then we get to telerobotic ultrasound imaging, which is kind of like the main star of the show and the girl who's causing all this like conundrums recently because they are trying to implement that soon in rural communities. And this allows sonographers, people who do ultrasounds, to use like a robotic arm to like examine patients remotely because of the shortage of sonographers. And this is good for situations where it can be dangerous for staff to be in the room and also for staff shortages.
Yep, they basically wander through the halls into each. I'd love to see this in person, and I feel like this is a show I would watch of like the little robots like zoning down the hall and then going into it. But obviously, when you into everybody's rooms. But obviously, when you think something about like the COVID pandemic, like imagine how helpful that could have possibly been to have be able to have those remote consultations. And then once again, there's even further. So you have disinfection and sanitation robots. They also would be like in the hospitals, and they would be equipped with like UV light and disinfectant sprays to kind of sterilize hospital environments. And then also, it actually has a lot of applications for pharmaceutical packaging because dispensing errors are obviously like a very huge deal when it comes to the pharmaceutical industry. And so remote robotic assistants or or robotic systems, guys, you know I can't speak ever. Robotic systems are very helpful in that they have been shown to reduce the reduce dispensing errors, and this can help in like dosage preparation, packaging, labeling, dispensing, like whatever it is across the board. You're basically just taking away the human error factor for it. So very, very cool. A lot of different aspects in which robotic technologies can be applied. And I also feel like sometimes when people think about robots, they automatically jump to like humanoids in there. And as somebody who's like literally working, one of my projects is very focused on robotics right now. Like there's so many different things beyond just like a humanoid. Like there's cobots, there's industrial cobots, like there's smaller scale ones that aren't necessarily like different limbs and stuff like that. So just saying this just to say like don't be too worried, y'all, because I promise you like a lot of the things that we're talking about, like we're simply talking about machinery, not sentient beings. Like,
Yeah, like honestly, in terms of robots at any turn, kind of like replacing the humans in these jobs, like I wouldn't even look at it in that turn, like sort of way, like because like they're just quite frankly not there yet. But the reason I even bring up like telerobotic ultrasound imaging specifically being something that is like a hot topic is because of the big beautiful bill that Trump passed. And within that bill, there was a $203 million award given to Alabama from the federal government's rural health transformation program that was supposed to help their current abysmal situation, quite frankly, in terms of their rural healthcare. Like right now, Alabama, like less than 50% of its counties have a singular OBGYN, which obviously like overwhelms large hospitals and leaves people who definitely need healthcare in often precarious situations. And in that $203 million, the state is using some of that money to invest into the telerobotic ultrasound systems because it would allow a sonographer to perform an ultrasound from a remote location using a robotic device without having to be in the rural county itself. And right now, they're planning to deploy them in 2027. And if all goes well, the next plan is to deploy again in 2029.
yep, they I've actually read through the document, like skimmed through the document, and that was something that there were multiple different initiatives in there, child, with the Make America Healthy Again slogan that, you know, underlies and ties all of this together. But it is something that not only Alabama, but states and even worldwide people have been looking at, which we'll discuss a little bit later. But robotic ultrasound systems aren't necessarily like a one size fits all situation. They can vary in complexity. It can just be purely like mechanical teleoperation with like a joystick, all the way to like incorporating haptic feedback and force sensors, which haptic feedback literally just means like touch. So for example, if you ever play a video game or something and you know how it will like vibrate and kind of like shake when you like hit something, that those are haptic feedback sensors basically. And a way that you can actually train robots, which is very, very cool, is that you can have a human like operate it and do like the, what do you call it, the operation. So like let's place a cup here and stuff like that, and then train the robot on that data over time so that it can independently perform it. Anyways, that's my inner robotics nerd. Oh no, I love topics like this. It's always very interesting. But like I said, they can vary in terms of their complexity, but they can also vary in terms of their levels of automation. So basically, like how much of it is the robot versus how much of it is like the sonographer, the patient, and an assistant. So the assistive devices, which to be honest, I think are the most common, the most like further along commercially, and also probably the ones that people will have the least amount of issue with. I can see the least amount of resistance for this one because there's still assistance being provided by some sort of an assistant who doesn't have to actually have any ultrasound experience. So this could just be a random nurse, you know, a radiology tech, a midwife, like anybody could basically come, or not anybody, don't just walk in and decide you're going to be the assistant, but any like healthcare, what do you call it, professional could be able to do this job. And basically they're holding a frame against the patient, and there will be a remotely located sonographer who's controlling a robotic arm on that frame that has an ultrasound probe on it. And basically, like, you know, the assistant will be making sure that it's properly placed, the patient will be lying down, and then the sonographer is actually moving onto like kind of like a cushion, you know, and it will be moving it, and then that motion will be being translated to the robotic arm to like move in the way so that the sonographer can pick up on the details that they need to. And a current commercial example of this is the Ad Ecotech Melody system, and that's a company out of France. So I actually watched the patient video. It's very, very cool. I could see this having a lot of different applications, even beyond ultrasound systems. And so, like I said, this is kind of the most commercially available variants of robotic ultrasound systems that are currently available, are remote robotic assistant ultrasound systems. And then the semi-autonomous ones are the ones where the sonographer would be the main one giving guidance, but there is the ability to automate for certain optimization tasks, so like image analysis and stuff like that. And then autonomous, which there's some companies that are working on it. While I was doing research and like clicking onto these companies' websites, not a prototype was seen. And as somebody who works in the tech space, I'd be looking at these websites like this is a whole lot of way of saying that, baby, you just got that Series A funding and you don't have a prototype for me to see yet. But the autonomous ones are basically going to be able to become capable of performing the ultrasound scanning and basically just optimizing image acquisition with minimal or no human intervention. So literally being able to take the images themselves and kind of adapt based on the sensor and imaging inputs. And a lot of these are obviously AI powered. So like the image optimization and the data analysis, like I was saying. And so varying levels of how robotic the system can be, and it'll be interesting to see as these technologies continue to be implemented what people kind of lean towards and what ends up being developed.
Yeah, and honestly, with the introduction of all of these like new technologies into any system or current space, the structures kind of have to change to work around that. Like, there's gonna have to be, you know, a different HIPAA structure. There needs to be like HIPAA compliant encrypted data transmission and like cybersecurity measures with all this new technology to make sure that we're like making sure there's not data breaches, data leaks, and people being able to access information that they quite frankly should not be able to. It also needs to be user friendly for the patient, the assistant, and the sonographer because you want it to be something that people are actually going to show up and do. Like, what is the point of the money and the time wasted if people do not feel safe, if people feel wary about the technology, if they're skipping their appointments, if they're like thinking it's shoddy, they think it's not going to work. And also, like, I do think it not aggravating and annoying healthcare workers as well is a big part of it because I feel like the like burnout and the exacerbation of working in rural medicine is part of the reason why we're even in this situation to begin with. And to me, one of the biggest issues as well is medical liability. As we kind of see a lot with rural medicine, like the scope of practice of a particular degree or certification can sometimes get kind of a little bent, stretched, twisted, and expanded more than what might be ideal in a situation with all of the resources. And due to that, like liability has to like change as well because like if and when things go wrong, like who is at fault is a huge question in medicine. Like recently, even in Alaska, they're finally allowed like nurse practitioners and physician assistants to practice without a physician that is like directly like reviewing their things and that they're reporting to, and they're the first state to allow that because of their like dire lack of like healthcare access in their rural communities, and that alone is going to cause like liability shifts, and it's going to be very similar to what's happening now with the remote robot assistants and a lack of like direct physician or provider at all overview on certain procedures.
Yeah, there'll definitely have to be questions about, for example, does the teleoperator, so the sonographer, have to have some sort of liability coverage? But then also, like, are the tech companies that are supplying these ultrasound systems also liable? And then obviously, like, credentialing, because, for example, certain states require you to be credentialed as a sonographer. But if you're going to be doing a teleoperation on somebody that's in one of those states that you don't have, like, it's definitely something that's going to have to be fleshed out. And then to Gold's point with the user-friendly aspect of it, sonographers actually have a lot of operational injuries on their job, which I didn't really realize, and it's very strenuous on kind of their joints, and just a lot of their wrists, and just the different, obviously, like placements that they have to put their bodies in. And so when you already have people who are having these operational risks associated with the jobs, like whatever system that you invent, you need to make sure that they have buy-in. And same thing, if nurses don't want to use your stuff, they are not going to use it. And a lot of the times people don't realize, and that's one main thing we were taught for B&B design, was that if the nurses don't want your product and you're trying to like pitch it as a hospital, like not as an assistive or at home device, but as a hospital product, baby, it's as good as gone. Because they're not ever going to actually use it. So the hospitals are never going to purchase it. So all things to keep in mind as this technology advances. So for our third and final question, which is of course where most of the discussion always occurs, is can remote robot assisted healthcare help to decrease disparities in care? And as with everything, like it's a very it depends situation, but I'll start off with some facts just about realistically what the landscape of rural medicine is looking like. So 21% of the population resides in rural areas, and these patients obviously tend to live further than the majority of healthcare centers, especially larger scale healthcare centers. And so that leads to disproportionately higher hospitalization rates, mortality rates, and chronic health conditions. And there's a shortage of everything in rural medicine, but there's also a shortage of qualified sonographers, echocardiographers, and other operators in these rural communities. And so you're kind of straining and already straight like a system that's already resource constrained, and then obviously you have to add to that an aging population as well within the United States, and so that places even more strain on a system that's really already buckling at the knees. Okay, and so you're really asking a lot of the few providers that are in these areas, and then people have incredibly long travel distances and just other things that are associated with getting to it. And so in many ways this remote robot assisted technology in healthcare is designed to kind of fill the gaps, and at least give some resources and some accessibility in areas where right now there really is little to none. For example, and this is every time I hear Saskatchewan, I just think of Chapel Roan. But anyways, University of Saskatchewan researchers actually did try this out. I want to say between like 2018 to 2021, and they actually were able to successfully deploy telerobotic ultrasound clinics in 3 remote Indigenous communities in Canada, and they examined 87 different procedures, and found that the use of the robot was actually sufficient for diagnosis in 70% of them. And to me, that is actually quite revolutionary. Like the fact that 70% of those ultrasounds was sufficient for like what the patient needed, and then obviously like the other 30% they would be escalated to actually have to go to like their nearest major healthcare facility. But to me that is mind-blowing and can do so much in terms of access to care, and the patients loved it too, because 95% of the patients said that they would be willing to do telerobotic ultrasound systems in the future, and that they actually thought like, hey, if this is sufficient for my needs and I don't have to basically do all of the hubbub that is required to go seek medical care, then yeah, I would do this in the future.
Yeah, like I think it's really a no-brainer that any like increased access to specialized care for people who are genuinely lacking bare necessities is going to make things a lot better. I think the complications come from the actual systemic issues that have led to the shit show that we have right now with rural medicine. Like, I think a part of the reason why there was such like large backlash from OBGYNs is like the way things are being painted, and the fact that like a lot of these things that could be objectively good and objectively helpful for these communities are being used in a way that is kind of like unethical. One, like when we look at rural communities, like we need to understand that they are also a vulnerable population, where we're talking about education levels to even know w- what options you have, and like when you can go to the doctor and what you should do. Like we're talking about like access to transportation, and we're talking about monetary issues. Like we're talking to a lot of people who are poor, in poverty. Like a lot of these people are oftentimes forgotten, and even when we're, especially if we're talking about indigenous populations in North America as well, like that can't be something that is like looked over in terms of their desire to use remote robotic assisted healthcare in these places. Um, it's just not the same as an OBGYN. And the way that was being spoken about in a way that was a bit too friendly and a bit too lackadaisical by Dr. Oz, about how Alabama's counties, half of them don't have OBGYNs. And then you're like talking about bringing in machinery for a specific situation, and it's just like, to me, like the through line is not fully there. There's a lack of disconnect between the huge situation that you just brought to my front door and the solution that you have provided. Like, great news, I crashed your car. Like, even better news, I gave you a $10 O'Charlie's gift card. And I'm just like, listen, like, it's like I think I really want to make it clear, like, listen, I'm big support of any technology that's helping. I think a lot of like physicians and people who are professionals in their field are too, but like the backlash is more so because of the like lack of preventative measures to keep physicians from leaving rural areas, and the fact that there's so many barriers to entry for people to actually want to come to rural areas. Like Alabama, who's over here with the near abortion ban, is gonna like now have a crisis about why people don't want to put their degrees and, quite frankly, their lives on the line, because maybe at any point you decide to save a patient's life when you did not wait long enough, and now all of a sudden you over here singing jail tunes, and you're in your like black and white hat, and you're over here just breaking the rock in the back when you was supposed to be in the hospital because you decided to try to be a good person and work in Alabama rural medicine.
No, literally. Honestly, it just reminds me of, and once again, if y'all loyal podcast subscribers, you know what I'm talking about, but it reminds me of EVTOLs, where it's just kind of like, nobody's saying that traffic in urban cities isn't really bad and that we shouldn't find ways to mitigate it. But I love how public transportation was not the solution, like flying cars was. And this is just how I feel, where it's just kind of like, I think that this technology is super cool. And I actually do think that more than the average innovation, because sometimes these things come down the pipeline and I'm just like, like I really, this could go either way with how this is going to pan out. I actually do see this having a very beneficial impact for society. And I do think that not just specifically for like ultrasounds, but expand, like remote robot assisted healthcare can really expand even to like developing countries like the global south. And if you have a clinic, you know, that, and you just have a couple of people who can keep the clinic running, boom, you could have a doctor from all the way across the world being able to give like life-saving kind of consultations to patients in areas where that previously wouldn't exist. So like I think the possibilities are endless, but it's back to the, like Gold was already saying, in this particular case with Alabama, where it's just kind of like there are so many other systemic factors that are playing into why healthcare in Alabama is the bits. Like, and not to be mean, not shout out to our Alabama viewers. Like, I'm not trying to, like, it's literally not y'all's fault, but like there's so many different things that are going on that is why they're ranking so low in terms of the way, and honestly just the US in general and how we think about and view healthcare, which we've talked about many times on the pod, and just the overarching glaring issues that like it seems like we're never going to solve, because no, every time we're given a good situation we never choose it. But it's just kind of like, it feels so minuscule. Like it just feels like taking a very small bite out of a pie that is literally laced with arsenic at this point. Like I don't know, like I just feel like OBGYNs and just healthcare providers in these rural communities require so much support. And also, like, as much as I hate it, like funding, because as much as we talk about like the other things that go on, like so much of them tie back to and are directly related to funding. And I just feel like what we fund in this country sometimes versus like what actually matters. And then also like it's always very backwards to me because it's just kind of like if we funded these things up front, you know, and then this goes into like public health and like, you know, community determinants of health. If we actually funded these things up front, we wouldn't have these issues downstream. You know, it's just like it's like you're trying to like fight the fire after it's already spread to the entire complex instead of literally just having fire preventative measures already implemented in the building so we wouldn't have to do this. But it's just like we just keep fighting fires. They just keep like buildings just keep being lit on fire and
Yeah,
we
and that's
never
like
do the preventative measures.
yeah,
Like
like that's like another concern that I have too. Because here's the thing, like even beyond funding, at the end of the day, you need the professional to want to be there because in terms of funding actual hospitals and the technologies, like that is abysmal. But rural doctors actually get paid a pretty penny, and like they oftentimes do get paid far much more with way less competition, and the job security is excellent, and they still rather fight for their lives in New York City. And like one obviously like quality of life and like certain like and city life desire is a part of that, but another big part of it is like I said, like I don't want to be arrested for doing my job. Like I don't want to like have to fight with 1,000 different things that you guys are doing wrong or just not addressing it as a whole. And that was like another concern I even have about telerobotic ultrasound systems and just like remote robotic systems being placed specifically when they do not have the specialist there, is it might take some of the responsibility that the government has to give these people like adequate health care and like kind of get them off the hook with things. Like people, I feel like people might hear things like this and think that like, oh, like now it's like it's okay that I have to drive 3 hours for OBGYN. It's not. It's really not. Like I have people coming to my clinic in Metro Atlanta from Alabama. Like that's not okay. And oftentimes these people come and they're devastated as how terrible their healthcare has been and how terrible their situation has been. The options are presented to them. None of them are good. They're on the brink of tears. They wish they could have came earlier, as if that was even a realistic option for them. Like it's just like again, I'm always going to be a supporter of this technology, and I think there might be a disconnect between seeing all these like angry OBGYNs online and thinking it's because like they hate these robots. But like I was even reading an article from OBGYN and she was like, these robots cannot come and answer an emergency preeclampsia situation. They can't do a cesarean section, okay? Like they can't do all of these things that like it's necessary for an OBGYN to be there for. So like when you stick them in these communities, it needs to be again in an ethical way that is actually meant to be for the good of the community instead of a get out of jail free card, which I have high suspicions that our government is doing.
it's definitely just crumbs off of a cookie, and like you, like it's just like avoiding accountability of actually giving these people proper health care and very much just giving like a here damn solution. And another thing that I think I have a big issue with techno solutionalism. And I think say this as somebody who was both an engineering major, but also had a global development minor. And so a lot of like my coursework for my minor was like studying previous, like, you know, development theories and development programs because we know how often those fail when we try to do them in the developing world. But this idea that if it's high tech enough, that that solves our problem. And like every technical solution coming along being like toited as like, you know, the cream of the crop and the new golden standard, and how it's just going to change so many lives and it's going to like revolutionize. And it's back to the like, but if you don't actually have a foundation, you know, if you don't actually have a base off of which to build things, you're not. And that's also why programs look different, because certain communities invested in getting that foundation in base and others don't. And then it's just like well, now people are disappointed in the technology, but it's like, it's not necessarily that the technology itself is bad or sucks, or like we need to, abandon this and go to the next one, and like it's all in the solution. Like, no, like it's all in the foundation and on which you are basing the solution. And it's just kind of like, you can't sow crops on barren soil, like you're not going to get anything when harvest comes through. And it's just like, oh, I feel like I'm all analogied up this episode. Oh my God.
She said, but
We're
it's
very,
time to bear the fruit you have sown.
no,
But
literally, this is so West African of us. But yeah, I just feel like, what do you call it? I had something to say about something you were saying earlier about like people even wanting to.
were there like doctors being incentivized to actually even be in those communities?
Oh, what you were saying about like the OBGYN that wrote that article about how like they can't do a lot of the like other very necessary functions of the job. I read one news article, and the OBGYN was also just like, at the end of the day, like this is not a replacement for human care. Like when you're thinking about like the vulnerable, precarious situations that these people are in, like I personally would prefer to just like be there with my patient. Like I would prefer to be able to hug them if they just received bad news, or to walk them through something that they're confused about, or to just have that in-person connection with them. And like while this is a solution that can help, and I think it should be accessible, like why not have it, you know what I'm saying? Like if it can help and be very accurate in situations where it would be more of a burden on the patients, but at the same time, like we also need to be actively working towards a future where everybody has a human in the room that is qualified, that is educated, that can give them the support that they deserve. Because I don't think that the rural mother in Missouri should have the robotic arm that's giving her the ultrasound in her second trimester, and then the like upper middle class woman in LA deserves to have the like, what do you call it, the OBGYN in the room. Like I don't
Really,
think
he
that that
deserves
is
to
something
have
we
the
should be
hug.
like that's not something we should be satisfied with by any means, even if the technology is very cool. But
Yeah,
yeah.
and honestly, I think the last thing I'll say about this is that, and this is maybe just like from a broader point, and it just goes back to what you said, Ilyana, about like just the idea that technology is going to solve all of the situations that we keep making for ourselves. Like, I think their STEM elitism that they are breeding into this grade school and in higher education right now is spitting out a population that thinks this is a good thing, think that technology is going to come here and save them, think that it's okay to expend all of our natural resources and throw away the things that we care about and that have helped us for so long because, like, there is a robot that's going to come and run and save us. Like, and baby, like when that does not happen, remember this. Remember this podcast. Like everything needs to be like these should be integrating into our society and like improving. I'm tired of the works in progress. I'm tired of the like unmet promises when it comes to allowing these tech companies to do whatever they want. Like, especially in healthcare, like these people deserve good healthcare. They deserve respect, and like they deserve to have specialists and real people and humans.
All in all, I think we'd say that this technology is very positive. It has the ability to be transformative. It has the ability to provide care and access to people who previously would not have had it. As with all things, it depends on who it gets into the hands of and how it's being utilized. But I would say on the Ilyana and Gold odometer, like we're feeling pretty optimistic about this new tech innovation, and all that we can do is really just hope that it continues to provide access and care for those who need it. But with that, let's get into everybody's favorite section of the episode, which is bits of BS. And for those of you guys who are new, to the show and to this section, it's basically just funny, annoying, interesting moments that happened while we were getting our bachelors, while we were in our undergrad. I'll go first. So my bit of BS that I thought was very relevant to this topic was that, I mean, I already touched on earlier how, robotics was like my first kind of love, like robotics, artificial intelligence. Like that's actually what I initially thought I was going to go to school for. I ended up doing my major in biomedical engineering, but I almost did a minor in robotics. And y'all, this is what stopped me. I went to like the minor side because as I was choosing which minor I decided I wanted to do, I obviously was reading through like what the requirements would be for all the different minors I was looking at, and also like what classes I would need to take. Because something that's very annoying to me is that sometimes the minor classes, like you have other prereqs that aren't like they won't put it on the minor requirements, but they'll be like, but you do need to have taken these two other classes. And so I was looking through it for robotics, and I remember just being like, why do I need to damn near be a CS major like to be able to do this minor? Like there were so many CS prereqs that I would have had to have done. I think some other like ECE prereqs or some stuff. And obviously it makes sense because once again, a very computer engineering, electrical engineering, like heavy minor. But I remember just being devastated because I actually really did want to do that minor, but it would have definitely set me back at least a semester, I think, of just trying to do so a semester. Because it was like another thing about the prereqs was that it wasn't even just like, oh, I could have taken them all at the same time. It would be like a prereq of another class, and then I would need to take that class in order to be able to finally take the minor relevant course. And I was just like, I'm not doing that, bro.
Well, that's you can clearly tell that some minors were curated for a major, and like when you try to be different, they will put belt to ass. Like,
No,
yeah,
literally.
like okay, let me stay in my lane because I'm doing this in four.
No,
Um,
apparently.
no, my bit of BS is incredibly relevant. Like coming into college from high school, especially a college that had like a lot of pre med students, I wasn't aware of a lot of like cultures behind things or like specific things that was like very lucrative when getting into medical school, and obviously like wanting to be in rural healthcare is very much giving like Charlie and the Chocolate Factory like golden ticket. um so people obviously just lie about it because like I mean they will check your like extracurriculars to see if you're about that life, but like people will definitely be like, oh yeah, I love rural healthcare, like I want to be in rural healthcare, like what are we talking about, like will they be a derm in New York City? Yes. But like how who's gonna stop them? Like,
No,
and I
literally.
thought it was just like so like it's kind of like quote unquote funny now that I think I've gotten used to like the everyday nonsense. But I thought it was so jarring when I was in freshman year and I used to hear people be like, ugh, like yeah, like I have to go and like do that thing and like to feed the homeless because like I have to show that I care about like underserved communities. And like they used to be actually aggravated as fuck to like do
Literally.
something like that.
That people are literally like in these service clubs, literally about to raise hell. Like they run it strict as hell because of that. Like there's no fun allowed because that people, their heart is in it. Like they really just
Not
worried
at
about the
all.
hours. They just worried about the hours.
No, literally, like they'd be like, yeah, like I'm obviously gonna apply to like redacted like school of medicine because like they're like big on rural healthcare. Like I'm gonna emphasize the fact that I really want to be in rural healthcare. And I'm like, girl, you want to be like a telemedicine psychiatrist in San Francisco? Like, what are we talking about? Like,
No, they were so strict. I was in one of the club's student hospital connections. They were real strict. Like they were literally like you had to like show that you were like engaged for like a certain amount of time and like go to a specific amount of events. And there was a whole portal that they had where you had to like upload like a physical receipt, like a picture of you at whatever event or whatever service event. And that was so that you could get access to the notion with like all of the like fellowships. And mind you, I wasn't even pre-med. So eventually I dropped that club because I was like, what am I suffering for? But like
no, like it's actually crazy. It just gives very much like sitcom vibes to me to see somebody be like genuinely turn up like, oh my gosh, like I have to go like feed the homeless.
like,
Like
oh
you
my
would
God,
think
bro. Like,
that like
I
they
have to
literally
go.
went to jail and they had hours they had to complete before they could get off probation. Like that's the vibe it was giving, like community service, like banging the gavel.
No, it's like, bro, I have to go volunteer to help poor mothers in Colombia. Like, ugh. Like,
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 boo.
boo,
Like,
boo.
what?
Like, that's genuinely what it be. No, I know. But no, I even as somebody that's not pre med, I've heard the rural medicine jokes 1,000 times. I'm like, oh, y'all are wow. And I guess it's very Coco Jones. Like, I guess you gonna do a two for a check? I don't know. Like,
They were an employee, not me though.
the one like good pre med in this world. But with that, guys, we hope that this is another fun one. As always, make sure to check the required reading to see what articles we looked at. Let us know if there are any topics that you want us to cover. Once again, bspodcast79@gmail.com or any of our social medias, bs_STEM. And to end us off, remain curious, remain educated, and always remain critical. We'll see y'all in the next one. Bye.